First of all, I want to say that the COVID pandemic was a late comer in Africa because, for example, in Cameroon, only around late March that we had our first declared cases. So I was in China when that happened, and I decided not to go back because if we go back to the history, in Africa, in West Africa, we also had the yellow fever, and China was actually among one of the only development partners that actually assisted us. So it was a way to also stay here and work together with the Chinese youth to see what we can do and also to learn. I agree with the last speaker. So what I will resonate with what Kate just said at Peking University, not only students, but also the youth, because there is also community leaders. So for example, I would translate Chinese measures into French or German, into African languages, because not only the Chinese local residents had to follow the rules, but we also had to make sure that us, the foreign students living in China, that we also behave properly, or we also make sure that our actions don't affect the others. So bringing back to because in 2021, I also visited 10 counties, within the pandemic. So it was also in a way to volunteer, to give away, to give my help, but also to learn. In 2021, I've been to Zhejiang, I've been to Shanxi, and I realized how developed Zhejiang was. The last speaker just mentioned about tracing and scanning the QR code actually started in Zhejiang and actually spread throughout China. So I realized that, and it was a good learning materials. I was also in 2021, I went to Shanxi. I served as a village official. So I was actually following the village, I would say, we call that the village chief, if we refer to Cameroon. And I stood there for quite some time, and I saw how actually they were handling the pandemic, but not that 2021 is also an important year for China. They have alleviated extreme poverty. They mentioned that. So, it was a two-in-one kind of experience for me to see how, the Chinese are coming together, how the Chinese government is putting the people at the center. Getting to the Wuhan example, two hospitals, we all know, two hospitals built in a week. That was actually a very, I would say, impressive achievement, a remarkable effort from China, not only in terms of public health, but also in terms of logistics, in planning and architecture. And for me, coming from Africa, that was very important. And what I did actually was to take all of that Chinese measures and to bring all of my community. So we translated that in pretty much all of the African languages to share that, because back home, the measures were not very developed. So we still had to learn, you still had to get information back then about what is the pandemic, how to avoid it, how to make sure that I'm safe. So we translated that into African local languages so as to get aware, the community aware. You have to know that Africa is a young continent, the youth. We have a little rough 70% that are actually less than 25 of age, less than 25. So the African 1.4 billion, the whole continent, but it's very young. So the young people had to be aware. What is the pandemic? What do I have to do to be safe